subject of Genome Phenome Analyzer, we all know what the genome is, and the phenome is the collection of phenotypes that a patient can have, and a phenotype is not just the name of a disease. A phenotype is a whole collection of findings. So the Genome Phenome Analyzer puts together the genetic information, the phenotypic information, and comes up with advice on the clinical interpretation. And the crucial point that I'm going to make in this talk is that it does so in a hypothesis-independent way, which has important advantages in terms of quality and in terms of speed. Let me first set the background in terms of the workflow for genomic analysis and give you a sense of where SimulConsult fits in and all of the very important activities that are done by others or that SimulConsult only has a minor role in. So the crucial part that we do is the clinical correlation of the variants. That's the genome phenome analysis. But it's a much wider process that we illustrate here as beginning in the clinical world and going into the lab and then coming back out to the clinical world with the feeling that the important clinical input comes from the doctor and the important validation of this seems to fit for the patient also comes from the doctor as well as the reporting. So SimulConsult is also involved in collection of findings, as you'll see when I present just a regular clinical analysis as many thousands of people use SimulConsult already, and many of you will have seen in Gene Reviews, SimulConsult is the tool that Gene Reviews links to for assistance with differential diagnosis. So people will put together the collection of findings. Some people are also using this as a way of an evidence-based prior authorization method. And then you get to the lab components. That to do a genome, there's a lot of expertise in sequencing the genome. Then there's a lot of expertise in aligning and calling the variants that are found. And then there's a lot of expertise in annotating the variants, for example, putting in the frequencies that help decide whether this is an unusual variant that could be pathogenic. So our key role is in the dark green here. We have some role in the light green, including the report, and you'll see some of that as we go through. So the integrated genome phenome approach is, this slide contrasts that with some of the other approaches that people are taking. One is a more clinical approach of filtering diseases using clinical hypotheses. So a lot of people will say, okay, let's just do a panel, and we'll do a panel for Charcot-Marie-Tooth disease. We'll just look at the Charcot-Marie-Tooth diseases, and we won't look at anything else. And the problem with that is if you're doing a whole exome analysis, you're throwing away a lot of information that could potentially be clinically important, and you'll see an example of that in one of the cases I present today. One of the other approaches is a more lab-centric approach, where you filter the variants using the genetic hypotheses, and then you look at the variants that look most worrisome from a genetic point of view, and then go through and ask, do any of those make clinical sense? And that if you filter too much, you can miss out on some of the diagnoses. If you filter too little, you can have a huge amount of information to go through to analyze. And what the approach that we do is different. We rate all diseases and all variants, and we combine that information. And I'll show you how we do that. Rating of all diseases is done in a very sophisticated form. We use full computational diagnostic decision support that clinicians use and will often use from a Gene Reviews article or just as a standalone. And we don't just use a list of, if you have this finding, think of these 20 diseases. And you'll see this software in operation in a few minutes. But let me point out the sophistication that's involved here. We use the frequency of individual findings in individual diseases, making up a database with over 100,000 data points, where a data point is a particular finding in a particular disease. And the power you get from this is that you can do the sort of things you do in clinical medicine of using pertinent negatives to discuss findings that are absent, and that has a big effect on the differential diagnosis. There's also other capabilities. You can get advice on useful findings, so the clinician going through a patient can get advice on what things would be worth commenting on, and that can be of enormous benefit clinically, as you'll see. Similar to the useful findings is sort of looking ahead, what would be helpful. Pertinent findings looks back and says, what have we put in was most helpful? And you'll see how that's important, not just in clinical analysis, but also in being the essence of the genome phenome analysis. We also include time course of individual findings in individual diseases, and includes both onset and